Stop. Before you schedule your next doctor's appointment. Before you agree to another routine test. You need to hear this. What I'm about to reveal could save you from unnecessary pain, anxiety, and procedures that could actually harm you. They call them routine checkups. Preventive care. They tell you it's for your own good. But for women over 70, some of these tests can do more harm than good. You're told more screenings mean a longer life. That catching things early is always better. That saying yes is the responsible thing to do. But behind the reassuring smiles and medical jargon is a billion-dollar system quietly pushing unnecessary tests, with risks most women are never told about. Radiation exposure, false positives, overdiagnosis, and treatments that were never needed in the first place. Surgeries for conditions that weren't dangerous. Medications prescribed for normal aging. And here's the scary part. Most older women never hear the truth. Instead, they're pulled into a cycle of tests anxiety, more tests, more procedures. While hospitals, insurers, and drug companies profit. Symptoms like unexplained fatigue, new anxiety after screenings, hormone crashes, even organ damage, all labeled preventive care. One test may raise stroke risk. Another can lead to lifelong infections. And according to a 2021 study, 42% of older adults received at least one unnecessary test that caused avoidable harm. Nearly half. In this video, we'll reveal the 5 health checkups women over 70 should never agree to without asking serious questions, ranked from least to most dangerous. And make sure you stay for number 2. It's still pushed in hospitals today, yet may double your risk of cognitive decline. Before we begin, let me ask you 2 quick questions. Have you ever felt worse after a test that was supposed to help? And are you curious what real medical research says you should and shouldn't be tested for after 70? Drop your answers in the comments. We read and reply to everyone with personalized guidance. Now let's start with number 5. And trust me, your doctor probably won't warn you about this one. The 5 tests to question. Number 5. Bone density scans, DEXA scans. For many older women, especially those past 70, bone density scans are ordered during routine checkups. These scans are officially called DEXA scans. They're meant to detect osteoporosis, a condition that causes bones to become weak and brittle. Sounds helpful, right? Sounds like responsible preventive care. But the truth is far more complicated when it comes to seniors. The natural reality of aging bones. Here's what nobody tells you. By the time a woman reaches her 70s, her bones naturally begin to show signs of density loss. That is expected. It's part of normal aging. It doesn't mean you're sick. It doesn't mean you're about to break. But here's the catch. Studies have shown that many of these changes are not dangerous enough to require medication. The medication trap. A 2015 report published in JAMA Internal Medicine found alarming results. Over 60% of women over 70 who were diagnosed with osteopenia, which is just a mild form of bone loss, were given strong medications. Medications that carry serious side effects. Jaw decay, osteonecrosis, spontaneous fractures, the very thing they're meant to prevent, esophageal ulcers, severe digestive problems. And the worst part? Most of these women were never at real risk of a fracture in the first place. They were given dangerous drugs for a condition that wasn't actually threatening them. The flawed comparison system. The problem lies in how these scans are interpreted. They use something called a T-score system. This system compares your bones to those of a healthy 30-year-old woman. Read that again. A 70-year-old woman's bones are being compared to a 30-year-old's. So even normal age-related changes in your bones can appear alarming on paper. Imagine comparing the skin of a 70-year-old to that of a 30-year-old and calling the difference a disease. That's exactly what happens with bone density scans. The real risk numbers. According to a 2018 study published in the journal Bone, women over 70 with no history of fractures, a T-score above -2.5, have less than a 3% annual risk of a hip fracture. 3%. That means the vast majority are safe without medication, as long as they follow simple strength and balance strategies. Real patient story, Margaret's nightmare. Let me tell you about Margaret. Margaret is a 74-year-old retired librarian and avid gardener. She came to us after starting on a bisphosphonate medication that was prescribed following a routine scan. Her doctor told her she needed it. She trusted him. Within weeks, she developed severe heartburn, difficulty swallowing, pain every time she ate. She ended up hospitalized for esophageal damage. When we reviewed her original scan, her actual fracture risk was low, and her lifestyle, walking daily, eating calcium-rich meals, getting sunlight exposure, was already protective enough. She never needed that medication. We stopped the drug, treated her symptoms, and today she's stronger and healthier without any unnecessary drugs. She told us, "I trusted that test. I trusted that doctor, and it almost destroyed my health." The better approach. If you're past 70 and have no history of broken bones, it's often better to skip the scan entirely. Unless you've had a recent fall, noticed shrinking height, developed posture changes, experienced unexplained back pain. When assessment is needed, tools like FREX, which calculates your real fracture risk using multiple personal factors, can give a more accurate picture without rushing to medications. And here's something most doctors never mention. Gentle resistance training 2 to 3 times per week has been shown to improve bone density by up to 6% in women over 70. That's according to a study from Osteoporosis International. No skin needed. No drugs needed. Just movement, nutrition, and time. Coming up next is a test you've probably taken every single year. A test you've never questioned. But it could quietly be doing more harm to your kidneys than you realize. And the scary part? The damage might not show up for months. Number 4. Annual blood panels that hide kidney damage. Most older women over 70 are told to get annual blood panels. These tests usually include checks for cholesterol, blood sugar, electrolytes, liver function, kidney function. At first glance, this seems like smart preventive care, catching problems early, staying on top of things. But when it comes to aging kidneys, routine blood panels often miss the real danger. And sometimes they even make things worse. The creatinine deception. One of the most commonly used markers in these panels is serum creatinine. Creatinine is a waste product that your kidneys filter out. Doctors use it to estimate how well your kidneys are working. But here's what they don't tell you. Creatinine levels are deeply affected by muscle mass. And after 70, women naturally lose muscle. This can make their creatinine appear normal, even when kidney function is already in serious decline. That means older women may walk around with stage 2 or even stage 3 kidney disease without knowing it. Their blood panel says normal, but their kidneys are quietly failing. The research. A 2022 study in the Clinical Journal of the American Society of Nephrology found alarming results. Standard creatinine-based blood tests missed early kidney disease in over 35% of women over 70. More than 1 in 3 cases completely missed. The researchers emphasized the need to switch to a more accurate marker called cystatin C. This marker is not affected by age or muscle mass. It gives a true picture of kidney function. Yet most doctors still don't order it routinely. The medication danger. Now, here's where things get even worse. When these standard panels give a false sense of security, doctors may prescribe medications that are toxic to kidneys. Medications like NSAIDs for arthritis, ibuprofen, naproxen, certain blood pressure drugs, some antibiotics. They prescribe these without realizing the kidneys are already vulnerable. That can push someone into rapid decline. Real patient story, Donna's close call. Donna is a 76-year-old retired school teacher who stayed active by walking 3 miles a day. She came in complaining of unexplained fatigue, swollen ankles, general weakness. Her regular blood panel had shown normal results just 2 months earlier. But when we ran a cystatin C test, her estimated GFR, the glomerular filtration rate that measures kidney filtering capacity, was only 44. That indicates stage 3B kidney disease. Significant kidney impairment that the standard test completely missed. Her fatigue and swelling suddenly made sense. And we discovered she'd been taking a medication that was quietly straining her already struggling kidneys. Within 2 months of stopping that medication, her energy returned. Her swelling reduced. Her kidney function stabilized. She avoided dialysis, but only because we caught what the standard test missed. The better approach. If you're over 70, especially if you're thin or have lost muscle, ask your doctor for a cystatin C test, either alongside or instead of the creatinine check. It's more reliable and has been recommended by the National Kidney Foundation since 2021 for elderly patients. Yet most doctors still don't offer it unless you specifically ask. The anxiety problem. Point one more hidden issue. Frequent blood draws can also cause unnecessary anxiety, especially when minor abnormalities show up that don't actually mean anything. A slightly elevated liver enzyme, a marginally low sodium level. These tiny variations might trigger follow-up scans or treatments that create stress without providing real benefits. Older women with stable health often benefit more from symptom-guided care. That means medical attention based on how you feel and function, rather than chasing lab numbers that fluctuate naturally. Next is a scan that's been marketed as a lifesaver. It's high-tech. It's impressive. It makes doctors feel like they're being thorough, yet it may double your risk of memory loss after 70. Number 3. CT angiograms. After 70, doctors often recommend heart checkups. Makes sense, right? Heart disease is a leading cause of death. One test in particular, the CT angiogram, has become extremely common. It's a scan that uses contrast dye to create detailed images of your heart's blood vessels. It's used to rule out coronary artery disease, the condition that narrows blood vessels and raises heart attack risk. Sounds responsible, but when used too freely in older women without symptoms, this test can quietly lead to serious harm. The kidney danger. First, the procedure involves a strong contrast dye. This dye must be filtered out by your kidneys. And as we just discussed, aging kidneys are often more fragile than they appear on paper. If they can't clear the dye properly, it can cause what's known as contrast-induced nephropathy. That's a type of acute kidney damage, sometimes permanent. The brain danger. But the bigger concern is what happens to your brain. A 2021 study published in Stroke found alarming results. Older adults who underwent multiple contrast scans within a 5-year span had nearly double the risk of developing vascular dementia, double the risk of losing their memory and cognitive function, compared to those who didn't have the scans. The mechanism is subtle but devastating. The contrast dye can sometimes trigger tiny clots, alter blood flow in fragile brain vessels, cause micro damage that accumulates. It's not immediate. The damage builds quietly over time, often beginning as forgetfulness or mild confusion, later progressing into something more serious. And most patients never suspect the scan. They blame aging. They blame stress. They never connect it to that routine heart test. Real patient story, Teresa's decline. Teresa is 79 years old. She came to us after her third CT angiogram in 4 years. It had started with mild chest pressure during exercise, which turned out to be simple deconditioning from winter inactivity, not heart disease. Each time, her arteries showed significant blockages. Each time, she was told everything looked fine. But months after her last scan, her family noticed changes. Memory lapses, mood swings, difficulty following conversations, confusion about familiar things. We reviewed her medical history extensively. No diabetes, no smoking, no head trauma, no family history of dementia. But those repeated contrast exposures stood out. We supported her with cognitive rehabilitation, changed her blood pressure medication to one that improves brain perfusion. She recovered some function, but the damage was clear. Her daughter told us she was sharp as a tack before those tests. Now she struggles to remember our conversations. When is this test actually needed? CT angiograms have their place. If a woman over 70 is experiencing clear signs of unstable angina, chest pain at rest, shortness of breath with minimal activity, fainting spells, symptoms that are getting worse, then the test may be appropriate. The benefits may outweigh the risks, but in stable patients with mild or vague symptoms, safer alternatives exist. The safer options. Option 1. Treadmill stress test with ECG monitoring. This can often reveal the same heart risks without exposing your brain or kidneys to contrast dye. Option 2. Coronary calcium score. This is a low-dose CT scan without contrast. It measures the buildup of plaque in your arteries. It's especially useful for assessing long-term heart risk, and it's much gentler on your body. The hidden tragedy. The worst part? Many women are never told about these alternatives. They trust the test without knowing it could quietly be affecting their brain years later. The system favors fast answers, high-tech images, definitive-looking results. But at what cost? We're now at number 2. The most commonly overused test in older women. Still pushed in hospitals every single day. Number 2. Routine pelvic exams. This one might genuinely surprise you. Routine pelvic exams, which include a manual check of the uterus, ovaries, and vaginal canal, are still performed on millions of women over 70 every year, even when they show no symptoms, even when they have no known risk factors, even when the evidence says it's unnecessary. What the guidelines actually say? According to a 2017 recommendation from the U.S. Preventive Services Task Force, there is no solid evidence that these exams in asymptomatic women reduce cancer deaths, improve health outcomes, extend life. None. The evidence simply isn't there. Yet the exams continue, year after year. The real harm. These exams can lead to false positives, findings that look abnormal on examination but are not actually dangerous. These findings often trigger a chain reaction. Ultrasounds, biopsies, CT scans, sometimes even surgeries, all of which carry risks. For older women, the risks are magnified due to age-related thinning of vaginal tissues, increased infection risk after procedures, slower healing times, greater surgical complications. The research, a study published in Archives of Internal Medicine, found disturbing results. 63% of women over 65 who had routine pelvic exams ended up undergoing at least one follow-up test. Tests that revealed no significant condition. All that anxiety, all that expense, all those procedures, for nothing. The incidentalloma problem. What's even worse? Many of these follow-up procedures uncover what doctors call incidentallomas. Small benign growths or cysts that would never cause symptoms or shorten life. But once found, they create anxiety, and many women feel pressured to do something, even when the best option is to simply monitor or do nothing at all. Real patient story, Eleanor's unnecessary surgery. Eleanor is a 75-year-old former chef who loved cooking for her grandchildren. She went in for a routine pelvic exam. No symptoms, no concerns. The exam detected a small ovarian cyst. Her doctor ordered an ultrasound, then a CT scan, then finally recommended surgery just in case. It could be cancer, they told her. Better safe than sorry. Eleanor was terrified. She agreed to the surgery. She went through with it, fearing the worst. But the mass turned out to be a harmless fluid-filled cyst, completely benign, common after menopause. It would never have caused her any problems. But the surgery caused plenty of problems. She spent 5 days in the hospital with complications. She needed 6 weeks to recover. The emotional toll was just as heavy. She told us afterward, "I felt like a ticking time bomb. I was terrified for months. And then I found out there was never any danger in the first place. All from a routine exam she didn't need." When is a pelvic exam actually needed? If an older woman has specific symptoms, pelvic pain, abnormal bleeding, unusual pressure or discomfort, then the exam becomes an important diagnostic tool. But in women who feel well and have no complaints, especially those who have already had a hysterectomy, completed their cancer screenings, no risk factors, the exam offers little benefit and can cause more stress than clarity. The better approach, a symptom-guided strategy. Exams and scans only when there's a reason. If imaging is needed, a transvaginal ultrasound can offer detailed pictures with less discomfort and risk. And newer blood tests like CA-125, while not perfect, can help evaluate risk without jumping straight to invasive procedures. Up next is number 1. The most aggressively promoted test of them all. You see commercials for it. Celebrities endorse it. Doctors push it relentlessly. Yet it may quietly harm memory, destroy gut health, and even raise your risk of sepsis, a life-threatening infection. And almost no one is warning seniors about it. Number 1. Colonoscopies past 70. Colonoscopy is often described as the gold standard cancer screening tool. It's recommended widely, marketed heavily, considered a routine rite of passage once you hit 50. Just get it done, they say. It could save your life. But by the time you reach 70, especially if you've had prior clear screenings, this test may quietly begin doing more harm than good. What the procedure involves. A colonoscopy involves inserting a flexible tube with a camera into the colon to look for polyps. Polyps are small growths that can sometimes become cancerous. To do this safely, the colon must be completely emptied using a powerful laxative prep. And this is where things begin to unravel in older adults. The dehydration crisis. The prep solution is extremely dehydrating. It flushes the digestive system entirely, removing not just waste, but also electrolytes your body needs, beneficial bacteria that maintain gut health, fluids that keep your organs functioning. In older women, whose hydration reserves are already lower, this rapid flush can lead to dangerous drops in blood pressure, kidney strain, electrolyte imbalances, confusion and disorientation, falls. A 2016 study published in the American Journal of Gastroenterology found alarming results. Nearly 28% of patients over 70 experienced moderate to severe dehydration after colonoscopy prep. This led to fatigue, dizziness, and in some cases, hospitalization. From the prep alone, before the actual procedure even happened. The microbiome destruction. But the bigger danger comes afterward. The colon is home to trillions of bacteria that form your gut microbiome. This ecosystem supports immune health, hormone balance, nutrient absorption, even brain function. After a colonoscopy, especially with polyp removal, the microbiome can be disrupted for weeks, sometimes months. This weakens the gut barrier, the lining that keeps harmful bacteria out of your bloodstream. If this barrier fails, it opens the door to sepsis. Sepsis is a life-threatening body-wide infection. The sepsis risk. A 2019 report from BMJ Open found terrifying statistics. Older adults had a 12-fold increased risk of sepsis hospitalization in the 10 days following a colonoscopy with biopsy, 12 times the normal risk. Many of those cases were in people who had no prior symptoms, people undergoing the test purely as a preventive measure. They went in healthy. They came out fighting for their lives. The anesthesia problem. Then there's the issue of anesthesia. Most colonoscopies use sedation to keep the patient comfortable. But for adults over 70, especially those with pre-existing cognitive vulnerabilities, anesthesia has been linked to short-term delirium, long-term memory decline, lasting cognitive changes. A study from Anesthesia and Analgesia in 2020 showed that 41% of seniors experienced measurable cognitive changes after outpatient anesthesia, changes that persisted for at least 1 month. Some studies suggest the effects can last even longer. Real patient story, Joan's tragged. Joan is 81 years old, a retired piano teacher who loved crossword puzzles and storytelling. She had a clean colonoscopy at age 72. No polyps, no concerns. But her new doctor pushed for another one 9 years later. Just to be safe, he said. The prep left her weak and dizzy. 2 days after the procedure, she developed a fever and confusion. She was hospitalized with sepsis. She spent 4 days in intensive care. Even after recovery, her daughter told us, she was never quite the same. Her memory slipped. Her appetite declined. Her spark faded. And the worst part? The test didn't find anything dangerous. It was completely unnecessary. When is colonoscopy truly needed? If a woman over 70 has never been screened before, has concerning symptoms like rectal bleeding, unexplained anemia, or chronic digestive pain, has a strong family history of colon cancer, then the test can still be life-saving. But for women who have had negative results in the past, have no symptoms now, are in otherwise good health, have a life expectancy under 10 years. Major guidelines, including those from the U.S. Preventive Services Task Force, recommend stopping routine colonoscopy screenings. The safer alternative, non-invasive stool tests like FIT, fecal immunochemical test, can detect hidden blood. They can be done at home. No prep, no sedation, no hospital visit. These tests, recommended annually for seniors who still qualify for screening, have shown high detection rates for colon cancer, with none of the risks associated with sedation, prep, or invasive procedures. So there you have it. 5 health checkups older women are often told to take after 70. Tests that may do more harm than good when used blindly. Bone density scans, leading to unnecessary medications with serious side effects. Routine blood panels, missing real kidney damage while creating false reassurance. CT angiograms, potentially doubling dementia risk with repeated use. Routine pelvic exams, triggering cascades of unnecessary procedures. Colonoscopies, carrying risks of dehydration, sepsis, and cognitive decline. Each of these tests has its place. They can save lives when used appropriately, but they can cause serious harm when used routinely without consideration of individual circumstances. The real message. The most powerful medicine isn't a machine or a test. It's personalized care. Care based on your symptoms, your risk factors, your health history. Honest conversations with doctors who understand aging. Don't accept routine as a reason. Ask questions. Understand the risks and the benefits. Make informed decisions about your body. Before you go, I want to hear from you. Have you or someone you love ever regretted getting a test or procedure that turned out to be unnecessary? What's one health decision you're glad you questioned or researched first? Drop your answers in the comments below. We're reading and replying to every single one with personalized tips and advice to help guide you forward. Your story could literally save someone else's life. If this video opened your eyes to something important, if it made you think differently about routine medical care, share it. Send it to your mother, your grandmother, your aunt, your sister, your friend. Every woman over 70 deserves to know the truth about these tests. The truth that could protect her health, her independence, and her quality of life. Thanks for watching, and I'll see you in the next video.